8 months post-op facelift, still experiencing numbness and pulling thickened scars. Should I get a second opinion? Is this normal? Enclosed are the photos of my facelift scars 8 months post-op. I have an indentation and tension and pulling on my right ear and still have numbness of the left ear described in my older posts. The scars are itching, red, and thick. Still, my biggest concern is my numbness on the left ear. Not sure if my ears look normal near the earlobe either.
Thank you for your question. You submitted several photos and you state that now you are 8 months after facelift. And you're describing two situations involving the incisions and the areas around the ears. One is the right ear, there's a pulling effect on the ear, and in the left ear you have some numbness, as well as a concern about the scars, the incision lines being very red and itchy. Well, I can give you some guidance based on how we manage patients like yourself in our practice. To begin with, just a little background, I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. Facelifting surgery is a big part of my practice, and I perform the full range of facelifting from short scar to full extended deep plane face and neck lifts. So in the absence of your comment in your question about your doctor's management, which of course is my first question is, what has your doctor been recommending? When we do facelift surgery, we see our patients very frequently in the first month or so, because we want to, there's certain times when you have to evaluate after suture removal and then see how things look in terms of the swelling and as well as monitoring the incision lines and the healing process. So I'm surprised that there was no comment about your doctor recommending X, Y, or Z about the earlobe or the incision lines, which I'm going to focus on for this response. To begin with, when you describe that pulling, you're basically describing something called a pixie ear. And a pixie ear, which is an interesting term, basically describes the way the earlobe is being pulled downward due to tension. And if the pixie ear is significant or is something that bothers you, then it will require some type of revision so that you get the natural shape of your ear back. So that's one thing that is kind of a straightforward issue that I'm sure you would address with your surgeon. As far as the incision lines being red and thick, well, the term that we use for that is called hypertrophic scar. And a hypertrophic scar is a scar that is becoming thick and red and very often is mistakenly referred to as a keloid. But nonetheless, it represents something called undesirable healing, where even with good closure, a person can develop thickened scars. So the standard of care is to treat these areas with a combination of a steroid like Kenalog, as well as an anti-metabolite called 5-fluorouracil. And in addition, in our practice, we've also been very successful with the use of platelet-rich plasma. Now, these are very basic ways to manage patients who experience these types of issues. Prevention is always optimal and desirable. In our practice, when we do facelifting surgery, one of the things that I try to do in the surgical side, when you think of what causes a pixie ear to form, and very often it's due to the tension on the skin from aggressive pulling or the direction of the way the skin is redraped. I will say that you don't want to pull too tight. I'm not saying that your surgeon did, but I'm just saying that in the way we do this, pixie ear deformities just really tend not to happen. In addition to the style of surgery and the type of level of tension, we also use platelet-rich plasma and material called extracellular matrix to help heal the incisions and minimize, at least to some degree, the chances for undesirable healing. Even with that, it is still possible. It's not like your surgeon could have completely avoided it, but sometimes you can still get thickened scars like yours or hypertrophic scars with advanced wound healing technology. But the point is that you still need management. And I'm just a little bit concerned that you didn't mention that the surgeon has been doing anything at this time, but if they did, it wasn't mentioned in your question. So again, to go back to the issues, at least with your right ear, there's the Pixie ear, the pulling of the earlobe that can be managed and should be managed at some point when the time is right. And two, hypertrophic scarring, which should be managed immediately if you're having these symptoms of redness and itching if it hasn't already been managed. As far as the numbness is concerned, sometimes in cosmetic surgery there's a disruption of sensory nerves, and very commonly it's been my experience that people have more of a numbness in the cheek area that gets smaller and smaller. By the time they see us at 3 to 6 months, they're really not bothered by it. If the numbness is behind and involving the whole ear, well, there's a nerve called the great auricular nerve that could be, it's what's called a neuropraxia, but or may have been traumatized during surgery. But this is something that it's better not to guess, but to at least discuss with your surgeon and have your surgeon assess which areas of the ear are numb, so you can actually determine what nerves may be affected, even though there really is usually not that much you can do at 8 months, but to observe. And we've also tried using platelet-rich plasma to help patients who have had comparable problems, who have come to us for second opinions to try to help improve the numbness. Fortunately, this type of problem doesn't happen that often, but it can happen. And it's important that you don't just assume that your surgeon did something wrong. With that being said, at least maybe you have some guidance now to address questions to your surgeon regarding a Pixie ear correction, as well as the management of the hypertrophic scars, which these are things that are actionable and can be done something about as your healing phase of wound remodeling comes to a close. So I hope that was helpful. I wish you the best of luck, and thank you for your question.